if you live in the U.S., you can walk into any hospital anywhere and get care.
100%.
You may not be able to pay for it after, but you can walk into any hospital and get care.
Welcome.
Thank you, fellas. Thank you, man.
It is so nice to have you here.
Dude, it has been a long time coming.
Definitely.
Been a long time coming. I've known you guys, God. I've been at Cedars, 19 years now? So
it's been 15,
yeah.
I think.
It was funny how we met.
But you look younger than us.
Dude, 51, 5 days ago.
Oh, happy birthday.
Man, look at all that gray. You
We
don't see all that gray?
have to go celebrate your birthday now.
We do. It's been a long time coming, man.
Definitely.
And I appreciate watching you guys grow. That's been incredible. I remember our first case, and she still haunts us a little bit. But funny thing is, enough, she's doing great. But
That's awesome.
we booked another plastic surgeon to help us, and she was out of town. And she's like, "You're gonna like my boys. They're cool people." She's like, "They're well trained. They're good." And I think you guys were brand new to LA. And I don't think I've called in 15 years another plastic surgeon since. So that ought to tell
Love
you.
it. Thank
And
you.
you've taken care of many of my friends, and just it speaks for themselves. And now look at where we are.
Yeah.
Absolutely.
Studio,
Right.
posters up on the wall.
Oh, yeah.
I think we've all come a long way since that time, man.
Absolutely.
Listen, besides being an accomplished surgeon and an incredible human being, you and your brother started a foundation that we were happy to, be a part of, albeit small.
Don't minimize it.
Which is known as the Hunt Foundation. And I think maybe what we can do is this, and we'll touch on your podcast too, which I think is phenomenal.
But at least that's not even the most important.
Yeah, but this is an incredible foundation that kind of goes back to roots and really giving back to people who do not have the luxuries that we do, especially in the field of medicine. And maybe you can kind of bring us through the history of why you started it, how you started it, and where it's come over the last 15 years or more.
Very easy to tell you why we started it. My brother and I and my sister, we've always said, we've gone this far from where we've come from. And now, what do we do with that? As you know, where we live and work in Beverly Hills, this is a bubble. This isn't the real world, And so we forget that outside of this little zip code, you don't even have to go as far as Africa.
No.
You don't have to go as far as Southeast Asia. You can drive 5 miles east and feel like you're in another country. And
Without a
so
doubt.
what good is having all of this if you keep it to yourself?
Sure.
I always say a life well lived is a life spent in service. It's one of those things where you either live to be served or you live to serve. And it's not what I'm saying like serving people, but you'll serve yourself, but you'll also live in service of those around you, because that's what people are going to remember.
It's humanity.
Like everybody else, I like the nice homes, cars, blah, 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 but it gets old.
Sure.
The car is going to get old. You're going to want a new one.
Yep.
Your clothes are going to change. Your watches are going to get old. Everything about you is going to get old and useless. And when all is said and done, your legacy is going to be how you treated people, whether it's in practice or in the people who you've never met. If you can affect people you've never met, then you've lived a good life. And that's all we can ask for. Like, for example, my father passed when I was 5. I don't know him. He died 6 months after graduating from med school. But here's the interesting thing.
He was a physician too?
Yeah, but he never practiced. He got leukemia while he was in medical school and was terminal his last year. And so he actually came from the hospital to graduate and then back to the hospital. And so he was 32 at the time. And so I don't remember him. And so what's interesting is when I hear people talk about him or just, oh, I knew your father, it was never, I knew what he had or I knew that what degree he had, whatever. There's like, oh, he was a good guy. He was this. Usually if people didn't like somebody, they wouldn't even mention that they knew him.
Yeah.
Because, here it is 45 years later. I don't care if you knew him.
Sure.
Did he affect your life and you somehow had an effect on somebody else's life because of it? cool.
Right.
And so earlier you asked about how the foundation was started. So that was the mindset behind it. A lot of people won't believe the story. I'm not going to name the names of the foundations because I don't want to get sued. But remember 2010 when the earthquake happened in Haiti?
Absolutely.
And literally the next day when everybody was on the news talking about we need people for search and rescue. And at that point in time, because of the type of injuries, they needed orthopedic surgeons and neurosurgeons for head injuries. My staff gets on the phone, starts calling everybody. Called 2 people in particular. One was the Red Cross. I'll say them because the Red Cross was like, all right, we're going to keep you in mind, but right now we're just doing search and rescue.
Right.
If we need some help on the ship that they take out there or anything like that, we'll let you know. Cool. The other very well-known one, we basically were like, yeah, we're coming. All you need to do is tell us where to plant our feet. You don't need to do anything else. And we'll get there. And they were like, well, have you ever worked with us before? Nah, but this is a good opportunity for us to help you. They literally outright told my assistant, that's okay, we're not interested, but they can send a check.
Yeah, exactly.
And I was just like, you were just on the other side of things saying you need people just like us. We literally, it happened, I guess, over a weekend. That Monday, we're getting on a plane to go to Haiti. We'll figure it out.
Right.
And got denied. So we're like, you know what? This is the problem with large foundations, bureaucracy. And we're like, we can do this on a smaller scale. And the foundation itself has no employees. It has no overhead. The overhead that it has, everything that we've done has been by the graciousness of other people and the money out of our pockets. And so we decided, let's figure out where we're needed. So we ended up going to West Africa and Gabon first. And we took a group of people from Cedars there. We did a bunch of surgeries. And it was difficult because of the language barrier. And realized that it just wasn't, and not just the language barrier, but just the politics of the country's leadership, is what I'll say. And we decided it wasn't a good fit. And so we sat around for a couple of years figuring out what's next, because the idea was to help abroad, but an arm of the foundation was also, my brother and I had this weird fascination or dream to one day make people walk again, suffering from spinal cord injuries. And so that's always been in the back of our minds, like we can do that at some point, but the low-hanging fruit, let's help people. And we realize what we do every day, if we go somewhere and I operate on 10 people or 20 people, I've only helped 20 people. Does that really put a dent in any problem in healthcare? Makes me feel good about myself because I went and did a few surgeries for free. That's why I hate the term mission trip, And so we're like, how do we affect a community? Let's figure out what's needed. It's not spine surgery. It's medicine, bandages, hospital supplies. And so what we started doing is gathering up all of those things and shipping and helping build a hospital. How do you change a community? Healthcare, education. So we started helping out an orphanage. And this particular orphanage in Ethiopia, if they go through this school and they decide that they wanted to go to anything in healthcare, nursing, pharmacy, medicine, whatever, their school is covered at the med school that we were helping support.
Wow, that's great.
Any student that came through.
Wow.
And so that's kind of, and what people don't see on the backside, they're just like, oh, you guys go over there and do surgeries. We're like, dude, that's the easy part.
Of course.
Doing the groundwork, having conversations with heads of state, trying to figure out how to get, an x-ray machine
Supplies
into
there,
a country without getting taxed on it and it not getting stolen.
That's the key. I was going to say, and making sure that money that's going there is going for the x-ray machine.
So we don't send any money.
Smart.
So, for example, the hospital we were working in has you'll understand, they're autoclave, they're sterilization equipment. It was built in the 1930s. It was an old gas steam one. And so we're sitting there like, so right at the time there was a company that was negotiating with Cedars to redo central processing at Cedars. And I was like,
Smart.
let me talk to them. So I talked to them and they were like, yeah, well, there's a company out of Switzerland. They were like, yeah, or Sweden, I can't remember. But they're like, yeah, we'll take a look at your hospital and tell you what we think. I'm like, dude, we just need help. So they went there, looked at the hospital, told us how to remodel the hospital. So we did it. And then they built the machines and said, this is how much it's going to cost for us to build the machines and get them to you. We raised that $114,000, which was a factor of 8 less than what they were charging Cedars for the same machines.
Wow.
That's awesome, though.
Yeah. And we built them, had them built, had them shipped over. And then as their gift to us, they put a biomedical engineer and a salesperson in Ethiopia and gave us the maintenance for free.
Wow.
And it was the first.
So there are good people out there.
Yes. And it was the first of its kind in Ethiopia.
Of course.
And so, but that's the thing that people don't realize. They're like, oh, but you don't make trips that often. I was like, it's not about me putting my feet on the ground. It's about
providing
the impact,
resources.
And hence,
it's that ripple effect.
Yeah.
You know,
and so,
I love how you started with education and, you know, well, listen, I want you to keep.
Yeah, no.
Story.
Yeah. And that's where, when we got involved with this hospital, that's how we met Tesfaye. And that you guys have been helping us so graciously with. He's a plastic surgeon who's basically like a one-man army. Just trying.
So listen to what he said. Because I spoke to him a lot this last time he was here. So for the people that are listening and the viewers, there's 100 million people in the country of Ethiopia. So did you hear what I just said? 100 million people. We asked him when he was here last time, how many spine surgeons there are in the whole country. He told us one. One spine surgeon in a country of 100 million people. Same thing for plastic surgeon too. So think about just what, I mean, even you're providing the resources.
We have over 30 that have privileges at Cedars.
Yeah.
One hospital.
I think we have like 40 or 50 in our building that we work at.
Surgeons, yeah, for sure.
You know, so
there's
it's
80 on staff. 80
and the only reason I brought that up is because now, Leonel, you're going to tell us what you've been doing with him and how John really has been helping, because it's impossible to go down there and operate it on everybody. However, if you educate, then you can treat the masses.
Education is key. And so what we decided years ago when we met with him, I'm like, the first thing we can do that's easy and meets with their technology is let's set up an email chain. Here's all the types of pathology that you see as a plastic surgeon, that your orthopedic docs see, whoever's in this hospital, what they see, send us cases. And we set up an email chain with every specialty we could think of on this chain that could have input. And as they send cases and pictures, we've responded. And this has grown over the years. But then what you realize, and I'm sure you've seen this, and I hope people are listening to it because I'm about to shame some people, not by name. There are things that have been sent to us that aren't your specialty, that aren't my specialty, but we've dabbled in it, or we know, but we've done our best to help, and there's been people on that chain who remain silent, as if they never get the emails.
Yeah, I noticed that.
Surgical oncology people, you know.
When they're tumors and,
right.
You know, all they have to do is say, hey, it's a 30-second email where you say, look, this is what we would do here. If you don't have that capability, this is what I would do.
Right.
Go down an algorithm.
But that's when you realize everybody's like, I'll help, but then they're silent.
Yeah.
You know, and I'm just like,
it's taking it to that next
right.
step.
So that's why I don't even acknowledge them. And every time we respond, you know, and you see the work he's doing, he's so grateful that he has. It's like when we're in residency and you're working, and you feel like you're doing the right thing, but you have Big Brother looking over your shoulder saying, yeah, you're good.
Definitely.
And that's what he gets from us.
Yep.
And what he gets from you guys, like, hey, I'm going to do this with this flap. Is this the right thing?
Thoughts? You know, and you have to imagine, look, we're so spoiled here that with some of the technology we have, you know, it's so far advanced that we say, oh, well, we'll just do this particular case. And Dr. Tesfaye would say, I don't have that.
Yeah.
Or I don't even, I've never done that. And so what I used to do in the beginning, and imagine people walking 100 miles to bring a child with facial deformity, cleft lip, palate, burns, hyena bites. I mean, I've seen some of the craziest things that literally.
But think about, we've seen more than one hyena bite.
Oh my God! Are you kidding me? It's a weekly thing.
Yes.
It's unbelievable.
Who gets bit by a hyena, man?
You know who gets bit by a hyena?
Yes,
poor guy who doesn't have a bathroom,
who has to go into the woods.
Yep.
Kids,
But the problem
4-year-old kids.
Problem is people don't know about this because of what you said. That little bubble and their Instagram or their TikTok doesn't show that. Instagram should show that.
Right.
And say, hey, look what's going on in here. Okay. But it doesn't.
And here's the crazy part, because, we follow each other on social media. The posts that should get the highest regards are the posts on my Instagram about him who don't get as much attention as they should. And it's the funniest thing.
Not at all.
I pump them out because you know what? That's what life is about. Yep. We were talking about people traveling. The last time we were in Ethiopia, it's funny because this time they put out a blast that these 2 doctors are coming to Ethiopia. We had 1,200 people sign up to see us.
Oh my God. 1,200.
1,200 people.
How long were you there for?
5 days.
Yeah, think about that.
Hold on. 1,200 people signed up to see us. Their doctors narrowed it down by their charts. And these are people that they actually had charts on. Narrowed it down to about 500 and something charts.
100 a day.
So we flew there. We'd get there on a Saturday. We went straight to the hospital. Staff, everybody went to the hotel. We're like, you get rest because tomorrow's going to be busy. Yeah. We go to the hospital, set up. We come back, me, my brother, and his PA. We sit there, and we just rifle through charts. Either it's going to be too crazy for us to deal with while we're here this trip, or this is low-hanging fruit. We can deal with this. And we just said, we'll see these. We saw, between the 2 of us and my brother's PA and another doc that came with us, we saw, in a matter of 2 days, laid eyes and hands on almost 200 patients.
2 days, 200 patients. That's unbelievable.
And when we had to stop seeing patients when we filled the surgery schedule for the week, because there's no reason.
What are you going to see them for?
To see them and say, you need surgery, but
You can't do anything.
that's heartbreaking.
Yeah.
And then when we were also there, as soon as we land, my brother and I take trauma call for the week. Oof. We take a phone and just all week you guys call us. So while we were interesting story.
Oh my God.
While we were seeing patients, this guy gets wheeled up on a hospital gurney from outside. His family brought him. I can't remember how far they came from. He was in a bus accident. Everybody died except for him. And he was paralyzed. And he comes in, he's got a catheter in his bladder hanging to a bag, not even a Foley bag. And he's flat on his back on this gurney and is like, is there something you guys could do? So we rushed him to surgery that day and did his surgery, decompressed him, fused him, did all this stuff. And we're like, because he was unstable. We get a picture, I want to say, maybe like 5 months later from his family member with the 2 of them. He's sitting in a wheelchair, and they were like, he's getting return of function.
Oh, wow.
That right there was
miraculous.
Makes it all worthwhile.
All of it.
All worthwhile because they don't have the ability to have spinal implants there because they're too expensive. Yeah. So you have an injury like that, they leave you in bed, either in traction or just leave you in bed till you're healed because there's no fixing it.
Yeah.
Because
which to us, that's
they can't spend $1,000. Right, they can't spend $1,000 for screws. I mean, there's no such thing as Prefo boots or anything like that.
No.
There's a picture on that I posted once where we were making heel lifts by taking rubber gloves, blowing them up like balloons, tying them together so they sit like this, and then putting the ankle on the gloves.
Oh my God.
And people are like, "What are you guys doing?" We're like, "It works."
Yeah, of course it works. That's
no
great.
pressure.
Smart, actually.
But it works. Yeah. Wow. But that's the things that people don't realize.
I mean, how did you repair some of this stuff? Did you wire it together, or did you bring?
We brought stuff.
Yeah.
And here's the crazy part, and some of these spine companies ought to be ashamed for this. We asked for stuff that's not new, that's in a warehouse that's outdated, that they're no longer using, they can no longer sell in the U.S. They donated us to take over there, and they were like, whatever you don't use, you have to bring back.
0 cents.
Used all of it.
But they know better.
No, but 0 cents.
Instruments back, or you'll be charged for it. And I'm like,
0 cents. Like, what is the sense? I mean, exactly. Oh, boy.
Yeah. One of the biggest game changers that I think out of everything we've done, we found, and I'll give Cedars credit for this, we found 2 10-year-old heart-lung machines stuffed in the bowels of the hospital. Wow. And the perfusionists at Cedars at the time got it refurbished, both of them refurbished for us, got the company to give us new parts.
Oh, wow.
And we shipped them to the hospital we were working in, and they were able to do the first 2 open heart surgeries there.
No way. That's great. I mean, like, think about that. Think about what you just said. The
And they did
first
6
two
of them.
open heart surgeries there, what, a couple of years ago?
This was
we do them left and
this
right.
was 8 years ago.
8 years ago. But again, it's not even we do them. There's 100 million people there. It's not like it's a country of 20 million, 5 million.
Yeah.
There's 100. It's like
Yeah.
a true, humongous country.
Yeah.
And it blows my mind. I mean, really. I mean, imagine if he didn't do this. Imagine if there was no Leonel and Gino.
You know, and we always assume that, yeah, at some point somebody else will pick up the reins and kind of do things as well. But you can't assume that. You can't assume, oh, somebody else will do it, so I don't need to. Bravo for you. I don't need
Right,
to do this.
no.
Because if everybody thinks somebody else is going to do it, nothing's going to get done.
Of course not.
And then we're stuck. And people don't realize there's crazy shit happening all over the world.
Mm-hmm.
You know, people always ask me, why Africa? It just happened to be the person that asked me to go.
You want to know the truth, though? They need
And
it as much as anyone in the world.
100%. People are like, well, why don't you do things here in the U.S.? And they're like, they'll be more likely to give to your foundation if you help people in the U.S. And my answer is always this. If you live in the U.S., you can walk into any hospital anywhere and get care.
100%.
You may not be able to pay for it after, but you can walk into any hospital and get care. In developing nations, Southeast Asia, South America, places like Africa, you can't walk into the hospital. The hospital we were working with, before your family member gets treated, there is a cashier outside of the ER that you come, you pay, they give you a pink piece of paper, and then you go in and your family member gets treated, regardless of what's happening.
Wow.
Because there is no insurance system.
And it's the most corrupt place in the world, too.
Yeah. You know, I remember when...
And so but when we told them we were there, no patient gets charged. I mean, you can charge the patients that have money, but if they come in, nobody gets turned away.
Yeah.
Give us the bill before we leave.
That is crazy.
That's amazing.
Because healthcare is something that everybody should at least have access to.
Sure.
And
I remember speaking to Dr. Tesfaye, and he, you know, we talk about, because he would send these photos, and I'd say, oh my God, it's how, you know, you have to imagine these people live in huts.
Yeah.
And to cook their food, they have open fires. They don't have gas furnaces or, you know, electric stoves.
Open flame.
Open flame. And so they have these little kids who are cooking because mom's taking care of someone else, or, you know, out gathering supplies, or doing whatever. And they get burned. And some of these poor kids, even adults that get burned from these fires, backing into it. You know, think about, I have 3 kids of my own, and they wrestle all over. I can see them backing into a fire, and each one getting burned. And so,
and the burn's not even the worst part. It gets so bad because they don't get care. So
nobody takes care of it.
So that's why they get all these contractures.
Of course.
The body heals. That's the beautiful thing about the human body. It's going to heal.
Oh yeah.
No matter what we do. Despite what we do to it, the body wants to heal.
Yeah.
It heals all screwed up.
You're
and
right.
that's where the big problems occur.
It sacrifices form for function.
And then you hear what Dr. Tesfaye said. You know, some of these kids that have these problems, the families don't want them back because they're defective.
Exactly.
And when you hear about these things, it just breaks your heart. Like, why did that one kid have to get that type of...
Look at the facial deformities. They're outcasts.
You're right.
Exactly.
Here's what's even crazier. Rectovaginal fistulas. The women who get those after childbirth get cast aside by their husbands because now they're filthy dirty. And so there was a woman who came from Europe who opened up all these fistula hospitals and has been taking care of it. And so now it's much better. And all you're doing is closing off fistulas.
Of course.
You guys have done them.
There's nothing.
But
it requires someone to do it.
Right. And your husband doesn't want to touch you because of what that is. And it's just, you become an outcast.
Yeah.
You know? And so many social aspects of not receiving adequate health care that we don't even think about. Mm-hmm. You know? And so when people come to my office, it's the funny thing. When people come to my office and start telling me what they deserve, I literally just kind of, I nod my head and I'm just like, you deserve.
Yeah, sure.
Cool. You're standing, somebody came out of my office the other day. His appointment was at 1:30. I showed up at 1:38 to turn the corner. And he's already in the hallway. Where's the doctor? But he didn't know it was me. He's like, where's the doctor? You know, he's behind. And I'm like, I'm actually the doctor. He's like, well, why are you coming to see me right now? I was like, absolutely not.
That's great.
I was like, absolutely not. Why? Well, you're 8 minutes behind. I was like, it took you almost 3 months to get this appointment. And you can't wait 30 minutes to see me? So you have two choices. You can go back in the room and be quiet and wait for me to see you. Or you can leave, schedule another appointment, and wait another 3 months. So you take 30 minutes or 3 months. You decide.
I'm going to start using that.
Yeah, because it's like,
that's great.
You came looking for me. I didn't go looking for you.
Yeah.
That is great.
But that's that sense of entitlement. And I think that lack of awareness and all of that, I think, starts at home. Yep. And you guys that have kids, it starts with you, And if I strongly believe if you're a good human, you can tell your kids all day to be good humans. If you live differently, your kids are going to live like you.
Yeah.
It's all lead by example at all times.
And I always think too, because we live, and this is why, my brother's kids I think are so well-rounded. You show them that this is not real.
Yeah.
You show them what real life is and say, this is how you be grateful. Because gratitude is so missed nowadays.
Big time. It's the entitlement issue, and that's all over the U.S. And
then they go to school with kids that, and you see it everywhere. And it's not just the U.S. Anywhere where there's access to money. Mm-hmm. And one of the reasons why we chose Ethiopia is because Ethiopia is not only, a lot of these countries, you have the people are poor, but the country's rich. Mm-hmm. Ethiopia is they don't have the same natural resources. They have coffee, leather, that kind of thing, but they don't have all the minerals and, gold, silver, blah, 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 that a lot of these other countries have. And so the country's not very rich. The people are not rich. You have 110 million people, and you got like 100,000 that actually are well off.
And you're corrupt.
Yeah.
And you're corrupt.
Shit, Washington's corrupt.
No, I'm saying, like when you talk to Tesfaye, that's all he would say. He was like,
it's corrupt.
It's just so corrupt that you can't even.
I mean, little things like we just sent, 10,000 colostomy bags over there. They just got there maybe about 3 weeks ago.
That's awesome. Wow.
And it took a lot of dealing with the Minister of Health and getting them to not tax us for bringing in. And it's still,
which is crazy to me because you're giving supplies to that industry.
And we still got taxed 3% instead of whatever.
It's the craziest thing I've ever heard.
I sent to Sae, not this time around, before I sent him some equipment. They went online, because in order to send things over there, you have to fill out a bunch of paperwork and then place a value on it, all that stuff. So I was like, cost $100 because that's what I paid for it. They went and looked online as to what it's being sold for.
Yeah.
Charged me taxes on what it's being sold for. The taxes that they charged for that piece of equipment were more than 1 month's salary for him.
Wow.
That's crazy. That's all of it's just crazy.
Well, listen, we love the entire concept. We love the fact that you are starting, from the ground up, educating, providing, and so they can really help themselves. It's that whole teach a man to fish philosophy. But how does anyone else get involved? How does anyone else, if they look at the Hunt Foundation and they say, all right, I like what you're doing here, would love to help at some point. I'm not on that email chain, but what can they do?
It's very easy. People reach out all the time, either through social media, at Hunt Foundation, or on the website, it's thehuntfoundation.org. There's a I want to help page, and you can donate, join the team, whatever it may be, and it fires off emails to me and my staff, and we answer them all. Love it. And nurses, and they're always like, I want to go. Cool. Everybody wants to take a trip. Do you want to help put in the work? Do you want to do what we do? Do you want to give your knowledge? Say, hey, look, I'm an ICU nurse. Can I come up with an idea for a manual for ICU nurses and give it to you to send over there? That's something easy.
That's great.
That won't but nobody's done it. I'm not an ICU nurse. I don't know how to do that.
Sure.
I'm not an anesthesiologist. Here's the meds they have. Is there a way they can do anesthesia? We're washing ET tubes and using them over again.
I remember going to South America and doing a couple trips, and we'd wash the gloves we just operated on. We'd literally turn them inside out, back inside, and then we'd operate on the next person.
Yeah, and our sheets they're cloth drapes. They're not paper drapes. You don't waste anything.
Yeah, you don't waste anything. Now, question, because there's a lot of people that listen to us that are medical students or other plastic surgeons.
Yes.
And kind of like what John just said. If they want to get involved, let's say they want to go there.
Yeah.
Are you setting up more? I know we were supposed to do one with you a while ago. Are you setting up trips, or is that something that's not?
We do go when it's safe.
See, that's the problem. And that's it.
When, it's easy for my brother and I to go and blend. It's easy for people who don't look like me to go, but they don't blend. And it's not that it's dangerous. It's one of those things where I don't want the liability if there's certain times when the State Department is like
saying it's high alert.
High alert. When the State Department's not on high alert for certain parts of the world, we'll go. It's crazy when you got to have like kidnap and ransom insurance.
Yeah.
Which I do.
Oh boy,
dude, I'm so overly insured. I wouldn't say overly. I'm adequately insured with things because we're targets no matter where we are in the world.
Right.
And now with social media and the internet, we have an electronic footprint that we can't hide. And that's okay because it brings awareness,
But it also brings awareness to something else. Yes.
Right. But it's one of those things where Addis, the capital city, is very safe. And that's where we do most of our work. As long as you're not at the borders.
Right.
But the border in California ain't very safe either. So it's,
as long as you're not going to Sudan, you're okay.
Yeah. But it borders Ethiopia.
Sure. No, I know. That's the problem.
Right. And so you understand that in the capital city, there's not much violence at all. There's no violent crimes. Nobody gets shot. You don't get gunshot wounds. None of that stuff.
So interesting.
Yeah. There's petty theft. That's it.
But when you go up north, or you go west,
or where you go where there's civil wars breaking out.
Sure.
Yeah.
Which is everywhere right now, especially down in Africa. I mean,
and so it's one of those things where if people say, next time you take a trip or how can I help? Dude, get on a plane. Let's go.
Okay.
We will never say, and anybody, it doesn't have to be in medicine, because I have friends that say, I don't know what I can do. You can come and you can help move patients. You can write people's names down. There's always a place for you if you want to help do something, because it literally, when we were seeing these 500 patients, everybody's a number at this point. And it's funny because you can't even separate them out by date of birth, because a lot of these people, which is kind of wild, they don't know their birthday because they're born at home. And the Ethiopian calendar's 7 years behind us.
What, it is? Different calendar?
Oh, yeah.
I didn't know that.
Wow.
So
looking at medications in the OR, we're like, oh, this is expired. Like 8 years ago. We're like, no, that's today's date. They're 8 years and a couple months or days behind us.
Wow, that's interesting. I didn't know that. That is so crazy.
It was separated from the Gregorian calendar, and so now they have both calendars.
Now, the interesting thing for people who are listening and watching, Leonel and his brother have as busy a spine practice as you can get here in LA. And that's the beauty of this, that they'll take time out of their busy practice to go help others. A lot of people don't do this because they're like, wait, I'm gonna lose money that's on the table. I'm gonna lose patients. I'm gonna lose my practice. I'm not gonna lose anything.
Nothing's
the reality of it is, exactly, they're gonna come and they'll see you and you'll be just as busy. But the problem is people don't think like that. And that's what we started with this conversation.
People forget why they became doctors in the first place.
Absolutely.
And I think even now, more so than ever, we as doctors change our mindset based on how insurance companies change theirs. That's terrible.
It's pathetic, actually. Yes, absolutely.
Yes, we all got to make a living. We all want to do well. Sure. And if you can't, you're a smart physician or a smart professional. If you can't find multiple streams of income to offset that week that you're going to be gone, then you got bigger problems. And I probably don't want you as my doctor. That means you're probably not smart.
and you're right. And it is. And when that's the whole point of it. When you're successful, give back.
One last statement that it's near and dear to me, and it's tattooed on my arm in my father's native language, French. And it says, if your presence doesn't make an impact, your absence won't make a difference. And that's
very true.
Stuck with me. Wow. And that is my mantra. Whatever that is. When people are around you, if you're not impactful on their lives, they're not going to remember you. Yep. And how do you want to be remembered? Yep. Or do you even care to be remembered?
Exactly. No, you're right. Leonel's got a podcast that we're going to be on soon. What's the podcast called?
It's called Sippin' on Excellence.
I like
with Coach KJ and Doc. So it briefly, Coach he's a personal trainer, life coach, and he's been my personal trainer. He kind of brought me back after my stint with cancer. And just kind of I went from 0 to now because he was that champion, pushing me. And so we'd always have these conversations while we're training, just about random life stuff. And he came to me one day, he's like, dude, we should do a podcast and we should call it this. And I was like, well, yeah, sipping on excellence is cool. I was like, but why don't we sip on something excellent while we're giving the audience something excellent to sip on? And so our topics are ranging about everything that people discuss about across the table, but are afraid to really bring out, And so we talk about men's issues, men's health issues. We talk about, we have an episode that came out today that's called No F's Given, meaning at what point in our life do we lose our filter? Yeah. Kids have no filter because they haven't learned how to have one. Sure. Old people, the elderly, have no filter because they've lived their whole life filtering. And so, but you have that middle road where you have to learn, what do I filter? And too many of us, not only we filter more of the good things while we blast the bad things. Yeah. And so I will tell you all day, all the shit I hate about you, but I'm going to filter telling you how much I care about you because I want to keep that to myself because I don't want to feel vulnerable. That's the dumbest shit ever.
Dumbest.
Right? But that's what we do. And so that's the filters. And so that's kind of what we talked about.
It's kind of like a no filter. Yeah.
Now, to get through life appropriately, you got to have a filter of some sort. You can't just go around saying everything you think.
He's been walking on eggshells with me for years now.
That's me. I'm the blinders.
It's like, oh no, close your ears.
But you have to. You have to know your audience. Yeah. You have to know who's sitting in front of you. And the whole message was filter appropriately.
Right.
Yeah. And that's kind of the stuff that we talk about. And it gets fun, and when you guys come on, we'll talk about sort of what you guys do, and because your world is wild.
Yeah.
Our world especially to me is wild.
Well, especially now because that Forever Young is what everybody's searching for.
Yep.
And which is great, and so they don't realize that Forever Young starts inside. Yep. If you are great outside and you're rotten inside, it's going to show on the outside.
Yeah. Absolutely.
No matter how tight you pull it.
And we deal with that a lot, bro. You've got no idea.
Or like people come in with this picture and say, I want to look like this.
Yeah.
And you're like, they don't even look like that.
Yeah. No, but it's the truth.
Yeah.
It's so true.
But yeah, so this is what you guys are doing, man. I religiously kind of pick topics. I'm like, oh, that one looks great. Yeah. And it's cool because I know you.
Yeah, absolutely.
So I know that what they're saying actually is them.
More amazing videos just like this one. Watch.
But I'm a huge believer that you can heal your body and heal your gut and be able to eat those things again.